Welcome to Rich Your Soul, Julianna Lindsey. It's great to have you join us today.
Thank you for having me. It's an honor to be here.
And I'm excited to learn from you. Let's start at the beginning. What was it like when you were growing up, and how much did your family and school teach you about money?
Okay, so that's a great question. So I grew up on a farm in Kentucky. There were six of us kids in the family, and of course our parents. We grew up on that farm. We raised almost all of our food. We raised our medicine. So my father in particular was not a fan of the standard healthcare. Now, that being said, my mother survived because of standard medical therapy. She had a very serious infection when she was a young child. And if it weren't for the Cosair Children's Hospital, she would have never survived through childhood. So I did have that mix of seeing the benefits of traditional medicine and also the benefits of a more holistic herbal medicine. We did not frequent doctor's offices a bunch. Our social contacts were very close. We lived in a small community, went to church a lot, and we had a large extended family. Those social connections and having that growing up and all that social support, I think was very transformative for me as a child and into adulthood. And we know those social connections are something we all need on an ongoing basis, really to live our best, richest life. As far as where did I learn about money, it was certainly not in school. I don't think I learned about money at all in school, with the exception of when I did go back to school and get my MBA. But even when you're getting an MBA, they don't talk about money management, right? They don't talk about how much money you should save, how much debt should you carry, that kind of thing. I was very fortunate to have a financial mentor in my life. A gentleman, he's now deceased, Pete Mahurin. He was a powerful influence in my life. He was into banking and finance. So I was very blessed to have Pete teaching me about money. And in our household, we have been very transparent with our children about money, how money comes in, how we decide if we're going to take on debt or not, and just how we manage money in general. So my children have grown up with money as just kind of a part of their life, and it's a part of their education. I think it's unrealistic to expect our school systems to teach children everything they need to know.
Do you know what it is about your dad that caused him to stay away from traditional medicine and look at these alternatives?
Part of it was familial habit. So I come from rural agrarian people, and I think our family tree has always kind of treated themselves. He had a very extensive knowledge of herbs and plant medicine, which he then passed on to me. And I've appreciated that teaching from him as well. I didn't realize I was being taught that at the time, but it's certainly something that has stuck with me throughout my life and my medical career. And I use plant medicine to this day. There's just not, you can't accomplish everything with someone's health, typically with prescription drugs. Prescription drugs leaves tons of holes in the management when you're trying to help people get metabolically healthy. So I do use quite a few supplements.
And we'll talk about that a bit later. What prompted you to be so proactive in teaching your kids about money?
I want to raise well-rounded children. And there is a phenomenon that my husband's also a physician, that my husband and I have seen it's all too common where physician families, especially two physician families, don't always have the most functional children. I don't know why that is, but we've given them real life teaching and experiences. We have not spoiled our kids.
I think when you have two parents who are in high stress, high paying jobs, they don't have the time. And so it's easier to throw money at the problem than it is to actually deal with the problem. And so that's why I think it happens. And you just have to be intentional about it.
And I absolutely agree with that. You can't buy your children off. You can't pay somebody else to teach them everything they need to know. You just have to put in the time and you have to put in the work. And that it requires time. And there is no substitute for your time when you're raising your children.
There is not. Time is one of our major foundational rocks that we look at. And a big reason for that is so that you do have time to be with your kids and raise them, because you only get so much of that.
And Rocky, if you think about it, time is it is the only non-renewable resource, right? You can get more money. You can even make new friends. But once this moment is passed, we are never getting it back.
And that is very correct. So what prompted you to decide to go into traditional medicine and become a doctor?
I'm sure part of that was knowing the journey my mother had been through as a sick child. And if it weren't for traditional medicine, if it weren't for antibiotics, then I would not exist on this earth. So it was very life-changing for her. Traditional medicine is why I'm here, because she survived that terrible illness as a child. Growing up in a small town in rural Kentucky, I really didn't have much of an understanding of what it took to be a physician. So I think I didn't entertain it earlier on just because it just seemed like that might be something that was out of reach for somebody who grew up on a farm in the middle of nowhere, right? So I was very fortunate to have another mentor in my life. He was our local family doctor, and he took me under his wing. I shadowed him a lot, and he really made me see that if other people can be a doctor, then I absolutely had what it took. And he highly encouraged me to go to medical school because he could see that I did care for people, which I think is a fundamental requirement. If you are going to be a good physician, you have to love people and care about how their health is and how they're doing.
And that's very true. It's good to see you. You've kind of mentioned that multiple times. You've had a lot of mentors who've helped
Yes.
you. And a lot of times people don't seek them out or listen. Is that just kind of the way you're wired, or what kind of kept that theme coming up?
Well, I had to get from where I came from, which was on a farm in the middle of nowhere in Kentucky. My father had an 8th grade education. He was an intelligent person, but he was not an educated person. My mother had a high school education. So there was no path that had been clearly laid out for me. I had to figure this life out, going to do better, and I planned to do differently. I won't say better, but I planned to have a different life than that. So especially Pete Mahurin, my financial mentor, Pete had come from, because Pete and I were related. So Pete came from my family, grew up in the same kind of place and situation, same family unit as me, and he had figured this out. So I very much valued his mentorship, and I've always been coachable. So I realized and have realized early on that I don't know everything. I think that's a really silly thing to think if people believe they can be masters of everything in their universe as knowledge. We just can't. And people who have had something to teach me, which people are teaching me every single day, I learn from my patients. Sometimes it's what to do. Sometimes you learn from other people what not to do. But I'm very teachable and coachable, and I've always been grateful for that. And I've tried to foster that in my children as well.
Yeah, it's definitely a trait that you have to learn, I guess. Some people have it innately, but it's not always the norm.
It requires humility, right?
It does. It also requires, yeah, and the opposite of humility is letting go of ego. And especially
Absolutely.
in the medical world, right?
That's such a great point. You may be familiar with my background, which is having managed tens of thousands of doctors over my career. I started that from right out of the gate when I was finished with residency. But the most dangerous physicians I've seen, ones with the most harm to other humans, the most lawsuits, they are people who lack humility. They lead with their ego, and they're not teachable. So I have also seen the ill effects of ego up close and personal my entire career, and seen how dangerous that is for a person as an individual and your mindset, but also in the realm of physicians, how dangerous that is to patients.
What's your view of the healthcare system? How well is it working?
Well, I think COVID showed most of us that it is entirely broken. The incentives are not there to keep people well and healthy. When you're in medical school and any other school that I'm aware of, be it pharmacy, physical therapy, whatever, no one talks to you about the potential for cure. It's just not in the lexicon that you can cure disease states. So most doctors go in, just have this mindset because it's the accepted mindset that you're taught that you're going to manage chronic disease. They don't have any thought about getting in front of it and preventing it, or let's say diabetes has taken a hold on someone. If you're early enough in that disease process, then we've been able to completely reverse diabetes, even if they came in with a diagnosis of diabetes. Heart failure can be cured. We absolutely follow standard of care in those cases. And I'm sure not all heart failure is curable, depending on, the cause. But we go outside the box while observing the standard medical therapy, those guidelines. We build on that with what is common sense and makes sense for that person as a cause of their heart failure. And we've been able to reverse that in several cases. So we don't accept chronic disease as a necessity. Believe, and have seen through our outcomes that most problems can be cured. There are obviously exceptions to that, but it's nothing that is promoted in the mindset of medical trainees that if somebody has neuropathy, that you could really engage with that person and reverse that problem, which can be that's another thing that can be a terrible problem for people, neuropathies.
One of the other things you talk about in your book is the fact that almost 100,000 people die of medical errors every year. And just to put that in context, that's like a big airplane crashing every single day. I think if that occurred, A, people wouldn't travel, and B, we'd run out of planes pretty damn quick.
Somebody would have fixed it by now, right?
Yes.
We would have thrown resources at that problem and fixed that problem. The way our medical system is set up is its payment is based on having disease. It's based on getting people into the clinic to check their blood pressure, just getting them to have surgeries, to do procedures. There's so much that can be done in regenerative orthopedics, for example, that can potentially avoid artificial joints in your body. But insurance doesn't pay for that. They'll pay for your knee replacement. They'll pay for your meloxicam, your painkiller to lower the inflammation and control your knee pain for the rest of your life. But insurance does not pay for things that are regenerative and look toward cure. So they do pay for your pharmaceutical to take every single day for the rest of your life and your doctor's visits with all the specialists that people get routed through to see.
That's why I pay cash. I don't have to worry about what insurance does and doesn't cover. We use insurance for emergencies or if you need a surgery or something. Otherwise, we go through the cash route. And it's amazing how much cheaper it is. And the fact that you have 100% flexibility of what, where, how, and when.
Yes.
And it's just so much easier.
Well, you get what you need that way. Now, we do help people use their insurance to pay for labs, which their insurance will most often pay for labs and imaging. We give them the right diagnosis code. But for our services, there's no way that we could bill insurance and be giving this kind of care. It would just be impossible.
And I have found that if you use the insurance, it might be more expensive than just paying cash. And so
absolutely,
a lot of times just paying cash is easier and I don't have to deal with it. And I don't have to deal with the back and forth of what do you want that? No, here's the list of tests. We're doing it. Have a nice day.
Yes.
So what inspired you to write the book, Radiant Longevity, a physician's protocol for living your best life?
Rocky, there's so much noise out, particularly in social media, but in the press, everywhere, around health. So many pseudo experts, just talking heads, people calling themselves doctor, but they don't disclose what kind of doctor they are. Maybe they have a doctorate in audiology, but presenting themselves as a physician. Those are very different things. You can have a doctorate in pharmacy and have a pharmacist present as a doctor, this and such. But then they don't disclose what their doctorate is, and people assume that the people they're getting advice from that they're physicians. So there's so much noise out there, and there's increasing noise around longevity, and everybody's trying to sell you something, and they're trying to sell you the magic bullet, which, sorry to say, does not exist. There's never one lever you can pull that's going to magically fix everything and make you live a long time. So, and another reason I wrote this book is I've realized that not everybody can afford to come see me, right? So it's a cost issue for some people. The techniques and advice I give in Radiant Longevity, it's approachable. It's approachable for any person. It doesn't cost you to follow these things. It's about how we can intentionally and thoughtfully live our lives and contribute to our longevity. And we know with science-backed evidence that there are many things that we can do just in our daily life that will help us live longer. And they're usually not that hard. But if people look at longevity like they just need this one peptide, or they just need rapamycin, or they just need this metformin, or whatever, that's not how you get there.
There are parts of the way to get there, but not
Maybe.
the path definitely to get there. Just because you mentioned audiologists, and it's something that I've been looking at, are there any cures for hearing loss, for like traditional old age hearing loss, or not really?
Not that I'm aware of.
Okay.
We've had some of the therapies that we do here in clinic. People say that their hearing acuity improves, but it's not been a reliable, consistent process for me to say this is going to work for everybody. We either find that it has worked for them in treating other conditions, or it didn't. So I can't say that there's any evidence for sure to reverse presbycusis, which is age-related hearing loss. So I think the best thing everyone can do is protect your hearing. So avoid really loud environments. That's super important. Because once you lose those little hair cells in your inner ear, that's a permanent loss. So people need to be very careful if you're shooting guns, or, in loud concert environments, earplugs, proper ear protection. Prevent it instead of try to treat it.
And that's, I think, a lot of healthcare, prevent the problem. And
Yes.
so, in speaking of that, the cornerstone are the two words everyone hates: diet and exercise,
Yes.
right? Followed by, when you talk about, is mental health and meaning. So let's expand on that, because what I have found is, if you look at the 80, a big chunk of it is diet and exercise. And yet nobody, it's easy to get in and out of the grocery store because I have that U that I follow. I don't go down the middle, so it's not hard.
Yeah, but you're exactly right. Diet and exercise is the cornerstone of living your best life. There's a lot of noise around that too. Everybody has their magic diet cure for this, that, or the other, and I can tell you that there's not one thing that's right for every person. And these extreme diets, you just might as well throw those out the window if it's not a natural way of eating. And I'll pick on the carnivore diet here for a moment. It is not natural for human beings to eat only meat in their diet, right? We've been agricultural people since it's just part of human civilization is raising crops, and our system has kind of evolved on plants as well as meat. So I think anytime somebody's trying to sell you a really extreme diet, you're going down the wrong path.
You mentioned plant medicine early on. What are some of the different plant medicines that you found to be helpful?
Well, I guess I think one of the most powerful plants that's in my armamentarium, and part of this goes back to my upbringing, is Panax ginseng. So American ginseng. It has powerful compounds and senolytics in there. That's a very powerful plant. I don't use it a ton in my clinic. I'd say that plants that I use most in the clinic are going to be things like turmeric. We use a full spectrum turmeric to address inflammation in the body. We use a lot of phytochemicals as well, which come from plants. Those are powerful biological agents in our body. And then there are numerous plants that are in mixtures, like adrenal adaptogens. Most of your adrenal adaptogens are going to be plants. So if we're helping people manage their cortisol, we may use licorice to increase cortisol, plant, or we may use holy basil, rhodiola, other plants to decrease the cortisol. So depends on what we're trying to do.
Now,
We use plants.
are you using the actual plant, or are you using like supplements that people would buy?
Typically, when we use it, we're using it as a pharmaceutical. So we are using the concentrated form in a supplement. But you can't supplement away a bad diet. So, and that's never what we're trying to do, because we need all those nutrients that we haven't even identified yet that's present in whole organic food. So we need all those things, the knowns and the unknowns that are in that food.
Have you found that most of the food we get today, though, is not necessarily healthy? I mean, we've gone from the kind of farming your dad probably did to corporate farming. And
Yes.
so now things have been so modified that it's not necessarily the same.
I absolutely concur. And that's a big reason why we have almost everybody on magnesium as a supplement. That's a good example of something that has just been stripped from our soils in the United States through commercial farming practices. Now, I grow my own garden and I test my soil. So I know that my soil has enough magnesium and boron, calcium, phosphorus in the soil so that the nutrient content of the food that I grow is excellent. Beyond that, I think it's hard to know. And I do recommend people grow their own food. You can do that in a very small space. Even an apartment in the middle of a city, you can grow some of your own food.
Can you grow enough?
Not to sustain you for everything in a small space, but I also preserve food. So I know how to can and how to pickle things and preserve food. So I will preserve food that I grow. And I'm afraid that's a skill that's going by the wayside. But that's how, when we grew up on the farm, that's how we made our produce last in the middle of the winter, is we had preserved it in some way. So we had year-round food. But it takes a lot of space to do that.
If somebody were going to start, let's say, an indoor garden, because that's reasonable to do, what are the handful of things you should have them grow?
I think lettuce is very easy to grow inside the house. And eating your leafy green vegetables is one of the 8 daily habits that I recommend in the book, because we know that having healthy leafy green vegetables on a daily basis can actually extend your health span. So I would start there. Small, like tomatoes, small plants, like dwarf tomato plants, they're growable indoors if you have the right light situation. But I think anybody could start with lettuce and have a very good outcome.
So you don't have to do a ton of different things.
No. If you're anything you do, and that's another thing, Rocky. I think there's too much all or nothing thinking in our society right now, and I do think that's promoted by social media. Things are definitely right or they're definitely wrong. That all or nothing thinking is not productive. You don't have to produce all of your food to benefit from producing some of your food. Get the benefit where you can, and just keep building on what you're doing.
We're hearing a lot about alcohol, and it also seems that for the first time in a long time, alcohol consumption is also dropping a bit.
Super glad to see that. One of the most destructive things that people can do for their body, alcohol is a neurotoxin, and the amount of liver failure that we're seeing and will continue to see, liver failure is expected to be epidemic in the next 10, 20 years from obesity and from alcohol. So women cannot tolerate as much alcohol as men. And I think for women, alcohol intake is especially destructive. It's a major risk factor for developing breast cancer and also thyroid cancer, which is way overlooked in women.
Same true for wine, because wine's gone back and forth, healthy, not healthy, a glass, 2 glasses.
I don't know. I choose not to put a neurotoxin in my system every day, and alcohol is a neurotoxin. Could the negative effects of alcohol be mitigated by, number one, drinking a small amount when you do drink, and number two, by having food on your stomach before you start drinking the alcohol? And I think the answer to that is yes. I think as long as people can keep it in moderation. Women should not drink more than 3 standard drinks of alcohol in a week's time, and never more than 2 at once. So I think people can keep guardrails, start eating before you drink a small amount of alcohol, and never drink an excessive amount of alcohol, then the harmful effects of alcohol can be negated.
Everything in moderation, and some things not at all.
Right. And I personally choose the not at all route for alcohol. It just, another reason for that is when I started wearing the Oura Ring, and I learned that if I had any alcohol, I get 0 minutes of deep sleep. That was enough for me to just say no.
So let's talk about sleep. How much sleep do people really need? Because, here in America, the less the better, right? You can sleep when you're dead.
That's what we hear. However, good, productive, high quality sleep will make you far more productive during the day, and you can't have your best cognitive performance. You may get by for sure, but you can't have your best cognitive performance in a sleep deprived state. And you're also not going to show up in your emotional, most patient, best self to your family and people around you when you're sleep deprived as well. So
No.
I think is a fundamental pillar of health that cannot be ignored. And if you're getting less than 7 hours of sleep at night, you need to really look at that with a critical eye and see if you think that's helping you or hurting you.
Does the different stages of sleep, like how much does that matter as well?
I think it's hard to get into the weeds that far for people. Like, if I don't, on my Aura Ring, I don't look at all the different stages of sleep on a daily basis. You can go down that rabbit hole and just get lost, and people get excessively worried. I think two things that everybody can look at and should look at is your sleep hygiene. So it'll tell you what time, if you are having a regular bedtime and a regular wake up time. Look at how much you're waking up at night and see what that's about. And then total sleep duration. So I think those things, like how long you've actually slept, are what people need to look at. And then if you want to go a little bit deeper than that, then you can get into the stages of sleep. But then you're talking about somebody that might need a sleep study and really a much deeper dive, sleeping with an EEG on for things like that. And everyone's pattern is a little bit different. There's no one right pattern. It's like heart rate variability, highly individualized number. And comparing your HRV to somebody else's is really not comparing apples to apples. Your HRV is your HRV, somebody else's is theirs. And what affects your HRV may be different than what affects somebody else's.
I'm assuming you're using your Aura Ring to capture your HRV, or?
I do, yes.
Okay. I use my Apple Watch, but I'm never sure if it's good or bad. And I have a separately HRV ear clip, but you can't walk around with that thing all day. But you can check in and see where it's at. And I do that every morning because supposedly it tells me where my body's at. If I need more rest or I can be more active on a particular day. Still trying to figure it out. I've been doing it a lot, but it says one thing and I feel another thing.
Well, I think that's an important point, Rocky. If it says one thing, but you feel another thing, listen to your body overall, right? If you're getting flagged that your HRV is low and you've not recovered, but you feel great and you really do feel like doing extra exercise that day or extra whatever, then do that. Trust your body.
I'm with you. The other one that I like to look at is VO2 max, because that's highly correlated with outcomes and longevity and health and so forth.
Yes.
But it's also one that's difficult to improve, correct?
Oh, I don't think it's difficult to improve. I think it's more difficult to get people to do the VO2 max testing, the proper testing with the mask and the bike treadmill. I think it's harder to get people to do the proper testing than it is to actually get movement on your VO2 max. There's some very well-defined things that we can do to improve our VO2 max.
How accurate is the VO2 max from like the Apple Watch? Because it gives me a number.
I don't trust the number on anything. Anything you're getting from the Apple Watch or Whoop, whatever, that's going to be a surrogate marker for your VO2 max. It's the best that they can do to predict it. If you're serious about knowing and improving your VO2 max, you just need to go have the proper VO2 max testing. It's kind of a pain, but it's worth doing, and it's actionable data. There's no question about kind of the accuracy of a proper full VO2 max test.
So let's say you have a low VO2 max. What are the actionable ways to improve it? I don't know if quickly is the right word.
Well, I do an activity survey first. What are people doing in their movement regimen, their exercise regimen? People are usually not doing enough cardio when their VO2 max is low, and the right kind of cardio as well. HIIT training is going to have more effect on your VO2 max than just staying in zone 2 consistently. So I do incorporate a couple of HIIT workouts into my routine on a weekly basis, and that's for my VO2 max.
So what's a reasonable number for how many times a week and how long?
For me, and I have my VO2 max checked in a serial fashion, and I want my patients to have it checked. Not everybody likes to go through the testing, but that is a number people need to know. I do 2 HIIT workouts per week, and they're 30 minutes each.
All right, so they are long.
You said it is long?
I said they're a decent amount of time.
But also, 30 minutes twice a week, pretty doable.
It is doable. What about just like zone 2 training? Is that equivalent? Not really.
Not for VO2 max. I think it's absolutely important. And I try to hit 180 minutes on zone 2 every single week. And I typically do that on my bike on long rides. And I also try to avoid road riding just because of the danger of cars. So I try to do trail riding because, all this stuff we do for longevity doesn't matter if you get hit by a car or if you fall off a ladder. So that's something else I talk to all my patients about is just like basic safety, gun safety, seat belts, wear your helmets, that kind of thing. Because if we die of something silly or preventable, then all this longevity stuff hasn't mattered.
And the other part of that is strength training.
Yeah.
So what would you consider, like you're talking lifting heavy weights?
I like lifting heavy weights. I like for my patients to lift heavy weights. But also, if you're just getting time under tension, which is what matters with muscle, and you can do that through resistance training, it doesn't necessarily have to be through heavy weights. You can get great time under tension with resistance bands. You can get great time under tension with the right Pilates. I personally do Legree Pilates, and I do that 2 to 3 times a week. And the time under tension on Legree Pilates is just unmatched. It's hard to get that when you're lifting heavy in the gym. So I think people can absolutely do other types of resistance training, and you don't necessarily have to be lugging around something heavy, although I do support that. But the most important thing is doing something that people will actually do. And if they find something objectionable, then we help them find something else that's going to have a similar effect. It's important that they be able to stick to it.
It's an objectionable until they start doing it and growing muscle and looking good. And then all of a sudden it's not so objectionable,
Right? And feeling so much better.
And
I mean, it's good to feel strong.
it is. I did about 17,500 pounds this morning of free weight. So my little app tells me how much I lifted. So I'm cool with
Well
it.
done. Excellent.
The other thing then is also looking at post-training or additional, the hot cold, sauna, plunges have become very popular. But when I started to look up the data on cold wasn't done at 34 degrees of freezing water. Most of the data was in the degree wise, which I think is what people don't get. You don't have to go into ice water.
You do not.
Yeah.
A good judge of whether that cold therapy is effective for you is if you feel kind of miserable and want to get out. It shouldn't feel good. It shouldn't feel easy. If the 50-degree water doesn't, if you've been used to doing it in 32, 33-degree water, which I would not be cold plunging in that degree of water. But if you're used to that, then, the 50 may not do it for you. However, you could take a break for a few weeks, let your system reset, and then you wouldn't have to go as extreme. You don't have to get in an ice bath to have your heat shock proteins stimulated. And heat shock proteins are stimulated by extremes in temperature. It doesn't have to be heat. It can also be cold. So it's just the temperature extremes that are giving you that longevity benefit.
I find the cold water until the warm water comes and the shower works. And then they have a sauna at our gym. So I'll go in the sauna. And in winter, it's kind of nice because after the sauna, I go outside in shorts. So I'm going from whatever the sauna is to like 30 degrees. That's my idea of a cold plunge, cold air, a little bit more tolerable.
Yes.
So shifting off to some of the other areas, though, is breath work. How does that fit into all of this?
Well, if we could all stimulate our vagus nerve more, we'd probably be happier, calmer people with a calmer nervous system. And the right breath work, that's what you're doing is you're stimulating your vagus nerve. And that is so important for nervous system regulation. It stimulates our parasympathetic nervous system. So the rest, relax, recover, which is always balancing out our sympathetic nervous system, that fight, flight, or freeze. So more parasympathetic is going to be healthier. You're going to have healthier cortisol levels. Your gut function is going to be better. Our vagus nerve's highly correlated and integrated with our enteric or gut nervous system. So everything just works better when we're in a calmer state. And that breath work can be very powerful for getting people in just kind of a better mindset and better able to cope with just the stresses of daily life.
And with breath work, you can calm the vagus nerve within a minute or two. Like it can be done extremely quickly. It's not like you've got to spend hours on this. You can very quickly change your emotional, physical state within 1 to 2 minutes.
Absolutely. And you can do it like in a group of people and they don't know that you're doing it, right? You take a deep breath, hold it for at least 5.5 seconds, because apparently that's where the vagus nerve really gets stimulated is with that breath hold of at least 5.5 seconds. Hold your breath that long, release, hold again. I'm a big fan of box breathing, but there's other breath work that's very valuable as well. Then that immediately starts to stimulate your vagus nerve. Humming is something else that stimulates your vagus nerve. So now you can't necessarily do that in a crowd of people, but it is a good way to stimulate your vagus nerve, is just to hum. The cold water stimulates your vagus nerve, unless you're under too much stress, and then you don't want to put your sympathetic nervous system into play. So there is such a thing as going too cold on the cold. If you are stimulating that fight, flight, freeze system rather than the parasympathetic system, then it's probably not doing you a ton of good.
That's true. And in the time you were talking, I was able to do it. Like you
I
said,
didn't even know.
it's that easy. And it really does help to calm the stress levels and the anxiety, which I think a lot of people deal with. And so it's there. Let's kind of switch over to the somatic side. I know in the book you talked a little bit about the body keeps score.
Yes.
And I think that's something that, people have heard, but they don't just fully understand.
Yes. I think you're right, Rocky. It's how trauma affects our body, our nervous system, our whole body, how we hold that trauma in our body and how it affects our health. And letting go of that trauma can be very difficult for people. And I do believe that it is at the source, not all chronic illness, but a whole lot of chronic illness is just that retained trauma in our body. I don't think that's the only explanation by any means, but I think it's very important in the overall health and longevity. Kind of how much baggage are we carrying around from childhood, earlier in life, current traumas, all that.
And we've done episodes where we've talked about autoimmune. And I think for autoimmune, it is a major factor in those particular things. With your patients, what have you found? Are people carrying around a lot of baggage, and are they aware of it?
Most people are carrying around some baggage, and there's varying levels of awareness around it. Sometimes I can meet somebody and I can predict with pretty good accuracy if they've had a major trauma in their life. I met a lady this morning that I'm sure she's got so many chronic health problems. I'm certain that she has experienced significant trauma in her life. And if I were to take care of her, then that is part of the treatment plan, is digging into that and figuring out how that plays into the root cause of her chronic illness.
How have you found to be the best way to deal with the trauma?
I don't think there's one right answer for everyone. And I could say that about pretty much everything, because we're each individuals. But you're going to need to talk about it with somebody. And I think you need to talk about it with a trained counselor. It is challenging to find the right person. Not everyone is as action oriented. So I think if you're just having talk therapy where you just, talk it out, that can be useful, but I think it has limited therapeutic benefit. I think you need somebody to partner with you to help you recognize the trauma and release the trauma. EMDR is sometimes very helpful in that respect. We are also using transcranial magnetic stimulation in our clinic, which directly affects the brain structure. That's a very helpful adjunct, that you need a trained professional to help you navigate this. And we have trained professionals that we partner with.
What about psychedelics in that space?
I think they can be a powerful tool used in the right way. I think if you're getting mushrooms off the internet and you're just microdosing every day, I'm not sure how useful that is. I think if someone knows what they're doing with the psychedelics, if you have and mind you, most of this stuff is illegal in the United States, so I'm not recommending that anybody break the law or put yourself in any kind of a compromised position. And a lot of people do go outside the U.S. to get these therapies. I do think they can be powerful. I've not seen it to be a magic bullet yet for people, where you have to be doing the work, and then psychedelics on top of doing the work, I think, can be powerful. I think they can just help people break down those barriers that all of us mentally construct, what I like to call our head trash. It just helps us clean out the head trash.
We've done lots of episodes on head trash.
Part of life.
It's part of life until you let go of it and you put out the
No.
trash, right? Sometimes you have to do that. And again, what I'm gathering is there is no one perfect solution. You've got
Yes.
to figure out just across everything that we've talked about what works for you. How do you react? Trying different things and being open to it. Kind of going right back to the beginning where you're talking about having mentors. It's just being open to trying different types of things and working through it, because I think we do have the ability to have a longer health span. And I know that I don't want to spend my senior years talking about my aches and pains.
Absolutely.
And I want to be fully mobile and livable. And, that was kind of like the one big thing when we were in Italy. You see really old people walking up and down really old steps that are not flat with railings and all
Very
those
steep.
steep, and they don't seem to even be out of breath.
Yep. It
It's
can
a
be done.
live life, right?
I think
Everyone.
it's important to do it with a trusted partner, though. Our ability to have true, accurate insight into ourselves is limited, and we just all need to embrace that and know that if you're just doing stuff yourself, experimenting with this, that, and the other, you're not getting the results, as good results as you could be with a trusted, knowledgeable partner to help you with the plan, the protocols, and just to navigate all that.
It seems these days everybody wants to take the easy way out, the GLP-1s, these drugs that are supposedly helping people lose weight quickly. I'm not a fan, and only because if you don't change your lifestyle, it's
Absolutely.
not. The second thing is, for a lot of people, I think they may be stuck on them for life because of the way they behave. And we're starting to see different ones, or, I don't know if the side effects are related or not related, but some of them have been shown to have some significant side effects if you happen to get that side effect.
Yes. Oh, it's definitely possible. They're not, no powerfully active biological agent is going to be completely free of side effects. Part of how those drugs work is slowing gastrointestinal motility. So it slows how fast food moves through your gut. So people get heartburn, they get constipation. Some people get diarrhea. I had one patient get pancreatitis, which is a very serious side effect. You can't predict who's going to have pancreatitis, who's not. He needed the drug though, so he's the one that pushed me to getting back on a GLP-1. We switched GLP-1s, but it took a lot of convincing, and I explained to him the risk of getting back on a GLP-1, but he's been able to successfully get back on another brand. Now he's a true diabetic. It's why he's on it on an ongoing basis, and he does all the right lifestyle things. His pancreas just got worn out, and he doesn't produce enough insulin anymore. But he's been able to successfully take another GLP-1. But pancreatitis is a very serious side effect. If you don't know your family history, or if you have a family history of having endocrine cancers in your family, it can stimulate a gene that's going to increase your risk of cancer. So it really needs to be done under knowledgeable medical supervision. And there's no magic bullet. You can't just take these things and do whatever you want to do and expect to have a good outcome. These should be paired with a whole food diet that is devoid of processed foods. And I can tell you, a lot of people, when they get on a GLP-1, their palate for protein changes. Protein does not become palatable for some people on these drugs. And I think that contributes to them eating less protein. And the last thing you want is loss of muscle mass. So when we use these drugs in our clinic, we have people check in on a weekly basis. So if people don't live in the area, if they live out of state, we like to touch base with them once a week, touch base on how much weight, what they've done with their weight, what they've done with their diet, and we keep people on the lowest effective dose. So we do a lot of microdosing of the GLP-1s, and it's not something people have to be on for the rest of their life if you do it right. Now, if you think it's a magic bullet and you can just go eat, a couple of Snickers bars a day and still lose weight, then you're gonna get a predictable outcome there too. It's just not going to be a good one.
It is not a magic bullet. None of these things are. You have to, at the end of the day, you have to do the work. You have to
Absolutely.
fix your diet and exercise and make those choices. And again, if you make the choices early and you do the things correctly, you don't end up in that situation where you need to do those types of things. And that's literally my goal, is to be as healthy as I can for as long as I can. I will continue to pay out of pocket because health insurance is for when you're sick, not for keeping you healthy. And so I'm okay with that.
I think that's well said about what the purpose of health insurance is for when you're sick. It is not to keep you healthy. And even though diet and lifestyle, diet, exercise it's work, it is work worth doing. So it is in no way a waste of time or effort. It pays off. It pays off every day in how you feel.
It does. And you can have a tasty diet.
Sure.
And I think that's where people get it wrong. They think that being on a diet is restrictive, and it is in some senses, but you learn to eat healthy, good foods. It's tasty, it's enjoyable, and life is good.
I don't know about you, but personally, if I eat highly processed foods, I don't feel well. I feel terrible, and I don't want it anymore.
When you feel terrible all the time, you don't notice.
If it's become your new normal, you don't realize what a hole you're in.
Yeah. And so you got to get out of it to realize, then you can see, I ate that and I feel terrible.
Yeah. Yesterday, my son's getting ready to go back to college here in a day or two. And he and I both eat really healthy, but yesterday morning I made a pretty bad choice. And we had donuts and coffee for breakfast. I still don't feel right. One bad dietary choice I made yesterday. So I am not eating any donuts anytime soon. It was just a bad choice.
In situations like that, I'll take one bite.
Yes.
And that's enough.
I ate the equivalent of one donut, but it was enough to throw me off.
That it will. Small things. And I think people don't really realize how much small choices can result in those types of things.
Well, our life is a sum of the small moments that we live every day and those little choices, and they get amplified over time. So intentionality is key, and consistency.
Very true. What's one truth about success you wish more people understood?
Failure is necessary. You should welcome failure. You want to fail. If you're not failing, you're not taking enough risk. You're not pushing the boundaries. You're not going to end up with anything innovative and life-changing for people or yourself. So embrace failure. Consider that a learning opportunity and a stepstone to further success.
And most people don't look at failure that way.
It paralyzes them because they're afraid to fail.
Maybe we need to make failure more natural and more rewardable appropriately. Smart failure, not silly failure.
Exactly. And to your point, there is a difference. I mean, there's neglectful failure, and then there's intentional. You tried something, it's part of a learning cycle. It didn't work out. You're going to try something else.
What did you learn later in life that you wish you would have learned sooner?
The importance of letting go, letting things go. You don't have to have an opinion about everything. It's not necessary.
Especially in today's world of politics?
Yeah. Letting go of things that are out of your control. It's out of your control. Why are you worried about it? If it's a modifiable situation, then get a plan. But worry is still unnecessary.
Smart move. If you were to give an 18-year-old one specific piece of wisdom, what would it be?
Be kind to yourself and others, and be coachable. Be willing to accept constructive feedback. I think there is an inability in a lot of people to accept constructive feedback. If some well-meaning human being gives them constructive feedback and it's not what some people want to hear, then that person will label that person trying to help them and give them constructive feedback as a toxic individual, and they don't need to be in my life. Well, if you just have people around you that agree with what you say at all times and never challenge you, you will not grow. You will stay in the same spot that you've always been in. We need people around us who have the courage to give us constructive feedback. And constructive feedback is not the same thing as toxicity. It just means you're not perfect and somebody may be trying to help you.
They just might be. If people would like to learn more about you, get the book, where can they do all of that?
The book's available on Amazon, Barnes & Noble, any major booksellers, and it'll be on Audible within the next month or two. And then our website is radiantlongevity.com.
And we will put that in the show notes. Thank you so much for joining us today.
Thank you, Rocky. I really appreciate it. It's been a wonderful discussion.
Hey, thanks for checking out the full unedited video of the Richer Soul podcast. You can get the full audio podcast with intro, outro, and a ton more details here on YouTube or whatever your favorite podcast player is. Don't forget, we've got hundreds of episodes for you to go back through, and you can also get episode information on the Richer Soul website as well. Don't forget to subscribe so you're automatically updated as to what's going on and every time we release a new episode. The first few episodes of the Richer Soul podcast actually lay out the entire framework that everything is built on over all of these years. So check them out as well. Thanks for listening.